As a note. Right, the first report is the annual report of the Chief Social Work Officer, and I believe is Alison on the call?
I am, convener, thanks.
Lovely, thank you, Alison.
Okay, so afternoon everybody. As the convener indicated, this is the annual report that is part of the statutory reporting requirements for Chief Social Work Officer. So it's a retrospective report that actually covers social work governance and activity during the year 2021. So some of the information within that you will have seen covered before in other more specific reports to committee. But there is an obligation on myself, supported by Diane as Chief Social Work Officer, to report annually to provide an overview of social work activity in the context of that activity, and with a particular focus on statutory functions. So that's the report that you've got in front of you this afternoon. I'm not going to go over it in detail. Suffice to say that it obviously covers a period where social work activity was progressed within a context of severe pressures related to the pandemic, and also reflects the impact that the pandemic had on our communities. You will see that actually most services continued, albeit being delivered maybe differently than we would normally deliver services. All services continued really throughout, with the exception of restorative justice services, which on Chief Medical Officer's advice had to be stood down for 2 periods during that 2021 year. So quite a lot of the information in the report really provides members with an overview, some of which again you'll have seen before, about how social work services adapted their delivery to respond to demand during that period of the pandemic. There's also information in there about the continued service developments across all care groups, and all of the improvement activity that we have undertaken over that period of time, as well as some specific information in terms of performance and activity around particular statutory functions, including around public protection and the role of the mental health officer. There is a short part at the end of the report that focuses on workforce and some of the challenges in the year ahead, and obviously reflecting the fact that there are continued demand pressures across all areas of social work services, whilst investment that you will hear a little bit more about today in some of the other reports is obviously very welcome, and particularly in relation to our adult services. But there remain some workforce challenges for us in terms of recruiting to be able to deliver service and to adapt to new demands. We also, and all members will be aware of this, are no matter the decision by Scottish Government and following the consultation on the National Care Service, will be moving into a period of substantive change, and the report reflects on the fact that that change itself will make significant demands on services, irrespective of the direction of travel, really, moving forward from that. So I don't plan, because you will have seen much of the content in other forms before, to go into much more detail than that. The first part of the report gives an overview of the governance of social work. And again, that will be familiar to you, although it's been updated to take into account the changes that were brought in under the Delivering for Communities paper that came through Council last year. But what I'm looking for today is, if members are happy to approve the report as the annual report for 2021, to remit it to the IJB also for consideration, and just if there's any questions, please, happy to take them.
Thanks very much, Alison. Claire.
Thanks, Chair. Really good report, Alison. Thanks very much. Really in depth. Just a couple of comments. On page 13, you talk about the joint social work leadership team with involving all social work heads of service. Really, really good. Have the trade unions been involved in any of the talk on that? You know, are they involved in that get together, for want of a better description?
Thanks, Councillor. No, they're not directly involved in that meeting, although I think what I've tried to portray in the report that is, although social work is obviously delivered through two different directorates or services now through adult health and social care and the Health and Social Care Partnership and Education and Families within the council, obviously the meeting that you're reflecting on is something that ensures that we retain a coherent approach across social work, and that we've continued really since the changes back in 2016 around integration. And what we do have though in terms of some of our other cross-cutting work within social work, and I think it's referred to in the report as well, is a group that's looked at health and wellbeing, and that involves union and wider staff representation. And that's really a group that's helped us look at how, when we have had to reshape service delivery within the restrictions that the pandemic have brought, and also looking forward to the change in the council's operating model, it's really looked at how we both continue to make sure that we're connected and can deliver services in a joined up way across social work, but also how we can make sure that staff have the appropriate supports in place to enable them to deliver best service. So that's where really the sort of staff involvement and the union connection comes into the structures that I've described.
Thanks, Alison. Could I have a supplementary, if that's okay? Just additional, just on page 15, you're talking about the Children's Services Partnership and the progress on the promise. And it's just to say it's really, really good to see, and the inclusion of young people really being involved at the heart of all of that. So thank you. So again, thanks a lot for that. Thanks, Chair.
Thank you.
Thanks very much. I don't see anybody else in the chat, so can we approve the report as per page 5? Thanks, Aggie. Right, let's move on to item 3. It's the digital and technology developments, and Maura is going to give that one.
Okay, thank you very much. The report this afternoon is intended as a kind of catch-up of a range of the important digital and technical developments. And I suppose as a context setter, the development of technology and the advancement of technology over the last few years has really been quite immense. So the change in practice of health and social care has saved lives. It's increased the access to service and direct access and increased quality of life. So the importance of the technological advances are absolutely recognised. The Strategic Commissioning Plan for 2020 to 23 has one of the 6 key ambitions specifically around the technology, so being at the forefront of technological and sustainable solutions. So we want to develop tech further, but we also need to develop tech further. We know that the demographics of demand, the impact of COVID and working differently over the last couple of years all means that we need to really be, I suppose, taking the good bits of learning, taking the changes that have happened and developing them further. So the focus on digital, as you'll see in section 1.2, is driven nationally as well in terms of a digital strategy for Scotland. And what we're really trying to embed is a tech-first approach. So in terms of assessment and planning, the first approach with people is what role can technology play to help people be independent and or as independent as possible and living good quality lives, good connected lives. The analog to digital developments with the changes to the telecoms system, which was originally intended to take till 2025, but has definitely been accelerated. And the associated impact that has on community alarms. So you'll see in the report that we've been successful in some partnership working with the Digital Office for Local Government and Tech Scotland, including the importance of partnership work and take a whole Scotland approach and how that applies within North Lanarkshire. But we've also been successful in some tech bids financially as well. So the report goes on to describe some key bits of work, the analogue to digital work in terms of the telephone infrastructure and the digital devices that are needed to support that is a big area of work. But within the development, how we increasingly push community alarms to be responsive rather than just reactive. At the moment, the service is more reactive than responsive. So the opportunity out of tech is really quite exciting in terms of shifting the focus of that to be proactive as well. The role of tech in supporting the home support redesign and modernisation work is recognised as a specific work stream within the home support programme board and complementary to the design, ensuring that we've really got a focus on the opportunity for tech to support the way that we operate. The telecare team recognises that we have got a lot of work to do to support the confidence in all of the workforce in relation to how tech is sustained and used to a greater extent, and how we make sure that the focus is on people and that the technical solutions follow the person rather than trying to fit people into technical solutions, which is something which is important to the personalisation of supports going forward. People might be aware of the Alashaw Tower flat, which has got a kind of live demonstration of tech, particularly tech that's available mainstream, so things like Alexa and Google's, and making sure that the kind of exploration of what's usually available to people is much more informed and accessible. The COVID-19 has meant that the flat has not been open for a period. So as we move through recovery and reopening, that will start. Although also the videoing of the scope really of the tech flat is a great way of helping people see things in action rather than just hypothetically. So it's a really good way of sharing confidence in the use of tech. Obviously, because we're a health and social care partnership, we engage fully with our health colleagues, and there are equally exciting developments within the health world in relation to using tech to a greater extent. So we actively participate in the Lanarkshire Health and Social Care Digital Tech Board and reflect that in our own North Lanarkshire arrangements. Other bigger developments include the replacement of the social work line of business system, the Swiss system, where progress is recognising the importance of understanding how that system currently operates, what's important for a future one. And you'll see in the report that there have been upwards of 75 workshops and interviews directly with staff at all different levels and functions within the service to ensure that we've got the procurement arrangements well informed. Near Me, lots of use of Near Me across health and social care and now wider services as well, which is really great as a video conferencing facility that makes it easier to support clinics and appointments and waiting systems, which is proven to be really important. The social work service used that prior to the pandemic, and that increased use of that through the pandemic has built confidence in increasing the use going forward as well. So we should see an increase in the use of Near Me, and Making Life Easier, which people may remember as the online self-assessment and information service, which has been for a long time a great addition to supporting people to access guided information and advice about their particular circumstances, but also includes direct access to provision of some small bits of equipment as well, which is good. So it continues to be developed. So I hope the report you feel gives a flavour of the range of work being undertaken and the importance of it going forward, but happy to take any questions. Thank you.
Thanks very much, Morag. Colin.
Yeah, thank you, convener. Yeah, forgive me if I'm asking a question that's actually answered in the report, just under different writing. But this committee and its predecessor had several reports and helped shape the use of the telephone scheduling system that the home support workers and others are using. It was just, I was rather hoping to see, after it's been in place for a couple of years, this report would have maybe have a little would touch on that to let us know how that had actually gone now that people have actually had a chance to get used to it. I don't know if you can touch on that a little.
Thank you, Councillor Cameron. You'll note on the agenda that the next item is an update on home support. So the development of dynamic scheduling and things will be incorporated more in detail within that report rather than duplicated within the reports.
You okay with that, Colin?
Yeah, that's fine. I had a
Thanks
funny
very
feeling
much.
I had maybe seen it somewhere else. That's why I said what I did at the beginning.
Just
Sorry, I'm
anticipating.
working away from home, so I don't have all my paperwork in front of me. I'm sorry.
Shocking. Claire.
Okay, thanks, Chair. Thanks very much, Morag, for this. I've got a few questions. I've got one, a few about the issue about the community alarms. I know that obviously the upgrade to digital, the work is ongoing. But one of the things it concerned me, and it's because of it's not council controlled, but it's the telephony providers migrating customers to digital without there being kind of any prior warning or very little warning to the user or to yourselves. And I say there is a kind of a workaround in them giving a SIM card. However, can you elaborate a wee bit that is how is the service being involved, and is this leaving people vulnerable? Is it relying on the user of the alarm to come back to us at council and tell us that they have now passed over to digital? Or is there any kind of liaison going on between the provider and council about this? And also just the upgrade, can we get regular updates? I know this kind of is the last one, but just to kind of keep us going and to let us know how that is happening. And also the redesign of the community alarm, if maybe elaborate a wee bit more on how is it going to be different or better to kind of going forward. And just on a sort of a couple of other things, the telecare team, I think that's an excellent idea, and thank you very much for that. And my last thing is, it's page 69, it's the procurement of the new social work line of business, and it's the staff, users and all that I've got together. How was the participation? How were people picked, invited? Was it voluntary? How were people brought together to actually be part of that? And sorry, there's an awful lot in that, so thanks very much.
Okay, thank you. I'll try and work through the points that you made there, Councillor Barclay. In terms of the liaison with the telephony providers, absolutely, there's close liaison. The absolute worst position would be people having been upgraded and assuming that their alarm is working and it's not. So the telephony providers are aware of the significance of the impact of that, and in the main have been happy to share in advance work that they are doing and to create workarounds so to give us time to ensure that on a person-by-person basis is not compromising anybody's individual safety. But it's a piece of work that is very current and ongoing at the moment. So I would offer some reassurance on that, although it does need us to be absolutely communicating clearly. In terms of some of the balance of national approaches and local approaches, I think the analogue to digital, and the national approach to community alarms is also something which we're engaging very actively in as well. And although the report doesn't include it, that includes things like the requirement now for interlinked smoke detectors. There's actually quite a lot of communication required around that. So we're linking strongly with our communications colleagues within the Health and Social Care Partnership and within the Council to make sure that we've got the kind of questions that people have answered within the response to the kind of changing picture, recognising that it is changing and changing fairly quickly. And certainly, as I said at the beginning, the shift from an assumed timescale of 2025 to 23 is actually accelerating a lot of that. In terms of the line of business changes and the people involved in workshops, it was a little bit of a combination of things because, as you would expect, we needed to make sure that the people involved in those workshops and discussions represented the full range of social work services, but people's involvement was voluntary. So nobody was forced to be part of it. But actually across the workforce in social work, there's real enthusiasm for getting a system which is modernised and does what we would hope that it would do and expect that it would do. So people's engagement in the process has been really positive, and folk have generally welcomed that.
You okay with that, Claire?
Thanks. And just kind of the last thing is just if we can give regular updates just to make sure if there are any major issues, if you can let us know, just again, if we can preempt it, just in case there's people coming to us, just if there's anything major, just to kind of let us know in the meantime. But thanks very much for that, Morag. I appreciate it. Thanks, Chair.
Thanks, Claire. Kathy, you've had your hand up for a while.
Thanks, Tom. I've just discovered that hand and it goes wild on me. I was just going to mention near me. I take it that's the same near me as the health service uses.
Yes, it's the same system. Yes,
same system. Well, it's very good. I've experienced it, and I'm not in a care home yet, though. But I've used it, and so has Tom actually, and it's great. It's great. You know, it makes things so much easier. You know, if you're not totally fit, you know that you don't have to leave the house and trail away. It was great. Can't recommend it highly enough. So, thank you.
Thanks,
Can I come back in, convener?
Yes, of course.
I think it's really great to get feedback on the experience of using it, but I think there's quite wide-ranging potential use of it, including examples of housing services, education services. So the convenience of being able to both have the quality of face-to-face contact, but not involving the travel, is got wide application and value. And certainly the ability to have people in like an electronic waiting room is a really good way of being able to be quite responsive and reactive to people, which is good. So it's although our experience of it has largely been around the restrictions that COVID have in place, there's much wider applications. So I think it's something that we'll see an increased use of in the future.
Thanks very much, Morag. I don't see anybody else in the chat, so can we endorse and support the range of technologies and note the report?
Yeah.
Thanks very much. Item at number 4 is the update on the rollout of self-directed support, and Diane, I believe, is going to speak to this one.
Thank you, convener. Thank you. This report provides committee with an update on the rollout of self-directed support in North Lanarkshire, promoting choice and controls well established in North Lanarkshire, with good examples of collaborative working and creative solutions to supporting people to live at home. The pandemic has impacted on the progress that was being made, particularly to those receiving home support services. There has, however, been considerable research undertaken nationally which has highlighted the inconsistencies in implementing SDS across Scotland. As a consequence, an implementation plan was published in 2019 and a framework of standards has recently been published to support implementation. In North Lanarkshire, there are 1,700 people who have their support delivered through self-directed support. The report reflects the work that has been undertaken to roll out self-directed support, focusing on key areas, including collaborative working across all elements of the sector and involvement of service users to plan and develop self-directed support. The lived experience of individuals is important to inform the rollout, and we will continue to work with representative groups, third and independent sector to improve access and outcomes for people. Section 2.21 highlights the work that has been undertaken with providers, and the flexible providers framework, which was approved, provides a strong basis for the rollout. The report also focuses on the work undertaken in the redesign of home support services and how integral that is to the successful rollout of SDS. Section 2.35 reports that 159 people have had their support delivered through option 2 arrangements, which provides greater flexibility. The report highlights the challenges in delivering self-directed support across all care groups, particularly around recruitment and the necessary system changes required for the full rollout. We plan to undertake a self-evaluation and review the strategy. The committee is asked to recognise the progress being made, and we will return to provide committee an update on a revised strategy. Thank you.
Thanks very much, Diane. I don't see, oh, I do, Claire.
Sorry, Chair, because I Claire roadshow today. Yeah, thanks very much for that, Diane. Again, I really appreciate it. I've got just a couple of things on it. At 2.7.1, it says that 171 people were not getting the level of support they require. Are you able to kind of go into a wee bit more detail on that? And the other thing at 2.8.3, the recruitment via the Care Academy, and kind of how it's going. I know that it's in detail a wee bit later on, so maybe if the details further on, and another report is kind of maybe that you can leave that one, but it's about the 171 folk that are not getting what they were looking for. If you can kind of elaborate on that one a wee bit for me, thanks.
Yeah, so that's the committed support that we have to individuals, and we have been working really creatively with families and carers and individuals to make sure people are supported at home. But as you're aware, the national recruitment issue and the workforce issues that we've had through the pandemic have resulted in us not being able to provide the full level of care that has been required. But as I say, I can reassure you that people are being supported at home, and we're absolutely supporting the carers as well through this.
You okay with that, Claire?
Thanks, Diane. Thank you.
Okay. There's no one else in the chat, so can we approve the recommendations on page 71, recognising the progress, and compel the Chief Officer to provide a further update? Yes? Take that as a yes. Thank you. Item number 5, Diane again, it's a home support redesign.
Thank you. Again, this report's to provide committee members with an update on the implementation of the redesign of home support services, which was approved in March 2018. Prior to the pandemic, considerable work had been undertaken, particularly in relation to the structure. However, during the pandemic, the workforce within home support has been under significant pressure to deliver services, which is well documented. Section 2 of the report focuses on the continued need to change and that the approved redesign remains relevant in light of the pandemic. The need to improve access, establish strong assessment and enablement processes, and redesign long-term and complex support at home remains necessary. Section 3 advises committee members of the support and infrastructure that has been established to fulfil the redesign, with a focus on 5 key areas: workforce, enablement and assistive technology, market facilitation and promoting choice, modelling and quality assurance. There has been specific involvement in home support during the pandemic, and Section 3.3 highlights the changes that have been made within the structure, as well as the ongoing recruitment of home support workers, and 3.3 provides the detail of the significant investment that's been made. Delivering a service of high standards and safety is a priority, and training of our staff is essential. Section 3.4 outlines the work that we have undertaken to make the necessary improvements to meet our ambitions, and this has included hearing the voice of those with lived experience, which will lead to improved service delivery, better communication and engagement, which will develop a more responsive service. Development of dynamic scheduling tool remains a priority for the service, and work has been ongoing with Digital NL to develop this. This remains a complex piece of work that we will continue to work on. The report also notes Home First, which is an approach that we have been focused on throughout the redesign, and further investment will support this. In Section 3, the model of home support is outlined. The service have worked tirelessly throughout the pandemic to provide a service and to make improvements. However, the direction outlined in the report will provide the necessary support and infrastructure to implement the redesign fully. The committee are asked to endorse the report and the progress that is being made. Thank you.
Thanks very much, Diane. Has anyone got anything for Diane? Don't see anything in the chat. In which case, can we approve the report? Yeah, thanks very much. That moves us on to item number 6, which is engagement and participation, and it's back to Morag for this one.
Thank you, Convener. The engagement and participation report you'll see is a report largely that's been prepared for the Performance, Finance and Audit Subcommittee of the IJB, but we thought that the relevance and interest from the Adult Health and Social Care Committee meant that it was useful to take it here for you to be cited on it as well. And the report, both reports reflect the fact that we've got a long established commitment to participation and engagement, ensuring that people who have sometimes been referred to as people with lived and living experience of disability or illness or difficulty are actively involved, as are carers and family members and community organisations and voluntary organisations, as well as independent sector providers, with the principles really that services are developed in partnership and planned with people, that all stakeholders are treated treated well, with respect, treated fairly and equally in the process, that we increasingly ensure that we've got accessible arrangements and the information is accessible, and that we embed engagement and participation in all that we do, so it is everybody's responsibility, not just the responsibility of people who have the particular lead for that. So the engagement and participation strategy for health and social care was signed off by the IJB in November 2020 and covers up to the up to April 2024. And this report really provides an update and refresh of the work, which has been particularly important as a result of the impact of the past 2 years, to make sure that we've got the right focus on that. So you'll see in paragraph 5.2.4 the range of stakeholders that we anticipate, 5.2.5 around the key actions, and 5.3.1 in relation to the key forums. So I'm not going to talk through all of the detail of that, other than to say that the importance of the range of forums is that that we're really clear about the purpose of the forums, clear about the actions, and we're able to demonstrate the impact of that. So we are doing a bit of work with Gina Alexander, who recently, until recently, was working with the Community Solutions Programme, is doing a bit of independent work for us to review the structures, so that the impact of the revised structure within health and social care, as well as the development of community boards, as well as the learning from the recent experience of COVID, helps us reshape that into something which is a bit more robust into the future. So it's a really good bit of work. And I suppose making sure that our focus on engagement and participation is about services, but not just about services. It's about health and wellbeing and good quality lives, and how we make sure that that happens. You'll see also in the report, in terms of engagement and participation, the importance of care opinion and complaints and working across organisations, particularly Partnership for Change, who've got a lead role in supporting voices along with other organisations as well. The report really is provided to endorse the approach taken and to receive further information as that is developed, but happy to take any questions in the meantime.
Thanks very much. Claire?
No questions on this, Maura. Just to say thank you very much for this. A really good report, and how important it is to engage with the users, because it's those that are going to tell you where things are going right and where things are going wrong, and maybe coming up with innovative solutions to things that maybe people haven't thought of. So thank you very much for the work that's been put into that.
Thanks, Claire. Nobody else in the chat, so can we endorse and support this approach and note the contents of the report? Yes. Thanks, Aggie. That moves us on to number 7, the market facilitation, and that's Morag again.
Yeah, sorry, you'll be fed up listening to me this afternoon. But, the market facilitation report is another one which I suppose reflects the importance of working in partnership. Continuing really with the theme from the previous report of openness, transparency, participation, partnership working, and this time, I suppose, more specifically with organisations that are paid to be in the environment of health and social care. The market facilitation plan sits alongside the strategic commissioning plan 2020 to 23 and the engagement and participation plan, which was subject to the previous report. And the market facilitation plan, in a kind of simple sense, is how we translate our commissioning intentions into services and supports, and how we're clear that they are achieving the best possible outcomes, and certainly achieving what we intended that they would, involving third sector, independent sector, and building, I suppose, a range of confidences in our direction forward, so that organisations can build their own capacity, can invest in the developments that support the market facilitation work in North Lanarkshire, and work towards training, support, mentoring that gets the right management capacity to support the frontline staff, which in turn supports the best delivery of direct service. It recognises really the importance of the social care and social work sector in the contribution that they make to the economic growth in North Lanarkshire, and recognises the importance of fair working practices and clarity of what we're doing. So the kind of main areas in terms of clarity are about demand and sustainability, so our demography, the impact of the kind of demand profile, what type of services people are asking for and needing, the impact of COVID obviously kind of goes without saying in relation to the last couple of years, but also the models of support. Diane was describing in the previous reports the Scottish Government push for improved discharge arrangements in Home First, discharge without delay, but also the importance of the implementation of the Carers Act and being confident that we've got what feels right, and that the development of the Care Academy helps us work across partners in relation to future workforce. The development of the market, again, is about really strengthening the partnerships that we work within. Subject to previous reports, the committee will have noted that we have got a 10-year flexible framework in place for support at home services, which builds real confidence into the direction forward, but clearly also gives annual joining and leaving facilities as well, which I think has been really important in terms of demonstrating our partnership approach and commitment to building confidence. But it's also important within that principle of working in partnership that we challenge ourselves and really ensure that collectively we've got the best response to people in terms of promoting choice and control. and other developments in the future will have impact on that in relation to national changes and national approaches. And community-based supports in terms of the significant importance of the third sector in our response and ensuring that we've got that embedded well into the way forward. Learning from COVID, I've already mentioned, and the essence of the market facilitation plan is working in partnership across a wide range of ways of engaging, which are detailed in the report, where plans are the way, action plans are the way of keeping that active and real for all of us. So for the council, for independent and third sector organisations, and also the public in terms of making that accessible and available. So how we share the action plans and how we ensure that we've got good and updated information on the website will be an important part of the next steps in relation to the market facilitation plan. Thank you, Convener.
Thanks, Maura. Thanks very much indeed. I don't see anybody in the chat just now. Is anybody anything from Maura on that one?
Yeah, Chair, I'm in the chat.
Oh, so yeah. It's because Claire Louise is just above you, isn't she? Oh, change your name.
Well, I have thought about it. Thanks again, Morag, for this another good report. Just a couple of questions I've got. At 2.27, it's talking about obviously the attracting new people into social care. And it's about the way of doing that. But it says that it is a bit concerning that over 50% of those invited to interview didn't attend. But you obviously you've got no control over that. But is there any sort of evidence of why they haven't came? Is there kind of a trend as to why they didn't turn up? And also, going from a previous one where there was 134 posts, kind of how many of that was actually, it said 58% of attendees were recruited, but kind of maybe elaborate on that. Is there any anecdotal kind of evidence on, you know, why they just didn't turn up? Is it because they've been pushed by like DWP to arrange an interview, but maybe they're just, you know, I don't know.
Yeah, I think it's an interesting question, because I think there's lots of different reasons that's the position, and I have to say probably recent times are quite a difficult way of gauging what it will look like into the future as well, because people's engagement in online interviewing is a wee bit different from face to face. So certainly we've got regular dialogue with providers. So the care home providers we meet with fortnightly, and the care at home in their various ranges we meet with on a monthly basis. So that kind of continued dialogue and learning from what's our experience as a council and what's theirs, and how do we make sure that we're adapting and kind of developing our recruitment processes to meet that. So some people, it's straightforwardly, they apply for lots of jobs at the same time, and the first one that comes up, that's what they go for, and then don't actually let people know that they're not coming. So is probably one of the biggest reasons for not actually participating. But as a way of ensuring that we're being much more flexible and dynamic, for example, looking at like recruitment, where we've got much more much tighter arrangements in terms of advertise or invite people to an information session and almost interview on the day, so that kind of speeding up the process and making sure that the length of time between advertising and getting in touch isn't what's actually facilitating that drop off to the extent that we have. And some of our independent sector providers are actually very good at doing that and helping people anticipate what they need to prepare and what they need to bring to be able to do that quite fast recruitment. So I think it's really just a challenge of the state of the market and the economy just now. So we do expect that to change, but I think it's actually quite helpful in terms of our approach to ensuring that people have got really good information, know what jobs are about, and are supported to consider that as a career as well.
Can I be supplementary?
Yeah, of course you can.
Just on that, of the 134 posts, have you got an idea how many are still waiting to be filled?
if I was in a room, I would be looking at my colleagues to see if anybody else knows the answer to that one. I would need to, Claire, I couldn't actually hand on heart say that I know the absolute number to that right now. I know that we've had much higher level of success more recently, but I wouldn't like to give you wrong information, so I can certainly find that.
Yeah, I won't put you on the spot. Thanks very much, Morag. Thanks for that. Thanks, Chair.
Thanks, Claire. And no one's got anything else. Can we endorse the implementation of the market facilitation plan, please? Yep. Cool. That takes us on to number 8, and it's the maintaining a positive balance of care. And Ross is going to speak to this paper, I believe.
Yep, thanks, convener. This is quite a positive update and probably sets out, I suppose, a success story over well over a decade, I think, of work in North Lanarkshire in terms of the balance of care and really trying our best to get to supporting people and meeting individual needs in the community as far as we possibly can. So if we just run through the report in terms of section 2.14, this is one of the indicators we need to report on through the annual performance reports. And it sets out a sort of standard metric of those who are 18 plus who receive long-term care at home. And you can see we're the highest mainland partnership in Scotland in terms of 75% of those with 18 plus with long-term care needs being able to be supported in the community. And again, as I say, this is a continual drive within the partnership to maximise this as far as we possibly can. But really is really the rewards of a huge amount of work over the course of at least 15-20 years in North Lanarkshire in terms of getting us to this position. There's a second metric that we quite often use, and the data for this is slightly more out of date, but those who are aged over 65 who received over 10 hours of home support. And that sort of 10-hour block was really taken as a sort of proxy measure for more complex cases. And to be honest, I think we, just with the number of individuals with complex needs supported in the community, that 10-hour metric probably doesn't really reflect the complexity that it once did. But even so, you can see this is 18-19 data, which was the last benchmarking data released on this one. And you can see our rate at 45%, sitting really high up in the table, third in Scotland and well beyond the Scottish average as well. Section 2.2 then runs through some of the care home stays, and obviously just as we'd expect to reflect, given the percentage supported in the community, we are further down in terms of the numbers of registered places in care homes for people in Scotland against the Scottish average. So the chart 3 sets out for over 65s and shows us well below the Scottish average. And chart 4 looks at the 18 plus metric again sets us down as the lowest number of institutional care places per 1,000 population in Scotland as well. So again, I think the important parts here as well is the fact that we don't just reflect on the balance of care and the fact that we're maintaining people at home in the community. The importance here as well is about quality of life and ensuring connections into the local communities as well. So I think that this needs to be seen alongside some of the reporting we've done through VANEL and Community Solutions Programme and things, as well as other bits of work like our enablement structure. When we set out the enablement programme through committee a number of years ago, we set the number of hours, the maximum number of hours is, number of weeks is 12 weeks for a enablement programme rather than 8. That quite a number of other areas had gone through in the past, and the rationale for that was so that we could do some wider work around community connections, etc. as well. So it's not just about supporting people in their own home, but it's about making sure people have got a really high quality of life connected into their own local communities to actually gain the benefits that can bring. Finally, section 2.3 just looks through some of the social work expenditure. And we sit just below the Scottish average in terms of social work spend per head of population. And again, it's probably not a great surprise given the fact that we've seen the sort of shift from institutional to community-based care. And obviously quite a significant amount of money can be tied up in some of the delivery of institutional care. So it's probably not a great surprise that we're sitting just below the Scottish average in terms of social work spend per head of population based on that. But happy to take any questions. Thanks, convener.
Thanks, Ross. Claire.
So it's a Claire roadshow today, sorry. Thanks again, Ross. A really good report, and it's really good to know that people are getting the care in the community, care in the home, rather than going into institutions. But it's just, my question really I've got is there can come a time where the care at home is no longer appropriate because they're needing the 24-hour care that they need. Are you content that there are kind of care home places available for people who, whether it be because of dementia, Alzheimer's, or severe illness, that actually going into a care home is then the direction of travel? Are we all right on that front?
We are. We actually benchmark quite positively on that one. In comparison to the rest of Scotland, we've actually got, you know, quite a considerable number of care home places across North Lanarkshire, and we tend to run with a relatively reasonable level of vacancy across that. I'm trying to pluck the figures out of my head. We've been doing this through some of the national contingency planning work as well, as part of the pandemic response, but certainly North Lanarkshire tends to benchmark pretty well in terms of vacant care home capacity. So we certainly do have that, and as you say, that there's certainly times when institutional care is absolutely the right and best mode for individuals, and we just need to get that correct balance. But I think what we want to make sure that we're absolutely maximising and giving people every chance they possibly can in terms of remaining connected in their own communities. And then when we do have individuals going into care homes as well, the exact same thought process is still there. You know, how do we maintain and support people who are within institutional care, still remain connected within the community, and, you know, with families and friends as well. So there's a whole range of work done in conjunction with Scottish Care, etc., around trying best to ensure that we get those sorts of programmes running through the care homes as much as we do in the community as well.
You okay with that,
Thank
Claire?
you. Thanks, Chair.
Cheers. Can we then endorse and support the balance of care within North Lanarkshire and note the contents of item 8? Yep, thanks very much indeed. Number 9, onto the contracts and financials. It's a framework for non-traditional respite, and Diane is going to talk to this one.
Thank you. Committee is asked to endorse the appointment of the 7 contractors detailed in the report, which outlines a flexible framework for the delivery of non-traditional respite. The framework was agreed to address the variations in the rates of non-residential respite. A competitive tender procedure was followed, resulting in the development of the framework to ensure that non-traditional respite is available to people who require it in North Lanarkshire. The proposed framework agreement is flexible with the option to remain operational for a maximum period of 10 years, and there's provision for annual entry and exit points for each financial year. The estimated total value of the framework agreement is 400,000 annually. Over the course of 10 years, the total will not exceed 4 million. In the absence of committee approval, the framework was authorised by the Chief Officer and approved by the convener as it fell out with the committee cycles. So the report outlines the procurement process and the monitoring arrangements for these providers on the framework, and it's recommended that the committee endorse the award of the flexible framework. Thank you.
My buttons weren't working. If you pardon the expression. Colin's first and then Agnes. Colin.
Thank you, Tom. Quick question regarding this. As I'm sure all my fellow councillors are aware, there has been, given the COVID situation, a lot of respite care facilities that were shut during this period, whether it's the traditional or non-traditional or the ones accessed via self-directed support. I'm wondering what's been built into this framework to take into account a probable surge in those looking to access respite care once these facilities start to reopen with the easing of the COVID restrictions.
Yeah, I think it's a good point, Councillor. I think what we're doing is we'll work with families and individuals. Some people have adopted non-traditional respite, looked at different ways to have for carers to have their breaks and for people to have alternative time either away from home or within home. So it's something we'll work through self-directed support, and obviously working with the providers as well, as we start to recover and the different providers start to recover as well.
Are you okay with that, Colin?
Yes, thank you. I wasn't expecting a detailed answer, and that's perfectly fine. Thank you.
Thanks very much. Agnes.
Hi, Diane. It's just a very simple question that maybe everybody else understands it, but I don't understand it. What form does non-traditional respite take? You know, what sort of support is it?
So it's traditional respite would be going to a care home. Non-traditional is something alternative which meets the needs of that individual. So some people go away for a break. Some people have respite in their own home. So there's a range of support.
Thank you very much.
Thanks, Agnes. On the basis there's no one else in the chat, can we endorse the award of the flexible framework for these 7 firms? Yes. So endorsed. And number 10, Nicola's been waiting patiently to give the capital monitoring report. Nicola.
Thanks, convener. This is the Revenue and Capital Budget Monitoring Report for period 10, which takes us up to the period 7th of January this year. As always, it provides a summary of the projected outturn position up to the 31st of March this year. So as detailed in the executive summary, the revenue budget is projecting an underspend for the year of 6.384 million, which assumes full receipt of £10.9 million worth of COVID funding from the Scottish Government. And there's a bit more detail given in that and later on in the report. Sections 2.1 to 2.6, I'm not going to go through in detail, but they provide the details of the significant variances in the report, with the main focus being on employee costs, which has shown an underspend of 373,000, and that's due to vacancy management. And then the biggest underspend is sitting within payments to other bodies, which is just over £5 million. And this is mainly within the care at home sector, which is linked to staff shortages. A point to note here is that these are expected to be in-year savings, and going into 22-23, we're fully expecting to spend all of those budgets. The other thing I wanted to highlight is that we're proposing to earmark the carers budget as a reserve at the end of the year to make sure that this full amount of funding that we've got available is used next year fully on carer spend. So I just wanted to kind of highlight that that's in the report. The reserves value is currently sitting at £16.7 million, with only £1 million of it expected to be used this year. So this means the remainder of that, along with any underspends that we've got this year, will be carried forward into next financial year. Now, there is an exercise currently ongoing to look at these reserves and in next year, what's currently been earmarked, are they still needed for the purpose that they're earmarked currently, and then where they could be utilised moving into next year and beyond. So as I said, we're projecting COVID funding of £10.9 million to come from the Scottish Government, so that's been factored into our year-end position. But the one thing that hasn't been factored in at this stage, and it's intended that we'll include it at period 11, is the winter planning funding of around £7 million, which is our share of the full 300 million that was released by the Scottish Government. So the business case for that is going to the IJB this week, I believe, to be fully approved. It's gone through the corporate management team of North Lanarkshire Council. And if this is fully approved, then the funding will be included at period 11. In terms of capital, there's some small acceleration of £127,000 been projected, but that will just be managed within the 5-year programme. Committee's asked us to acknowledge the financial position and the position regarding the reserves, and happy to take any questions.
Thanks very much, Nicola. Claire.
Yeah, no, just a comment, just say again, thanks for the report. And it's been such a, I think if I use the word fluid situation, I think that doesn't quite cover the stress, anxiety and the blood, sweat and tears of what really has been happening over the last 2 years and how you have managed it. But again, I think it's always worth seeing. Thanks very much for the report and the work put into it.
Thanks, Councillor.
Thank you very much, Claire. Can we acknowledge the finished positions on the report? Yep, thank you very much indeed. And finally, is the Adult Source Performance Report for Q2, and Ross is going to talk us through that. Ross?
Yeah, thanks, Convener. So this is just the usual report we bring through committee each cycle, and this is setting out our Q2 July to September 21 data. And if we go to Appendix 1, there's sort of two main service areas that are marked red and amber, and this is looking at our enablement services and the integrated equipment and adaptation service. So we'll kick off with enablement. So in terms of indicators 2.2 and 2.3, we can see the numbers going through the service. This is cumulative numbers. So we've had 720 at the end of Q2 against a sort of target at the end of year of 2,000, so we'd expect to be about 1,000 through the service by the end of Q2. So we can see the volumes coming through the service are obviously down, and we can see that reflected in 2.3 as well. So it's down to 59.9% of new or increased home support packages that were able to go through the enablement service, against a target for the service of 70%. And pre-pandemic, we were comfortably sitting beyond that 70% target. And then we can see the percentage of people with no or a reduced level of home support at the end of the process was sitting at 65.5% against a target of 70%, so not quite as high, but still actually a remarkable figure. When you think, and it just highlights the impact that enablement has on people being able to get that early enablement can reduce their ongoing service needs quite considerably at the end of that 12-week programme. This has largely been due to the impact of the level of demand coming through the home support service. And the challenge for enablement has been the fact that the home support service has been really badly constrained through the pandemic, through demand and also the COVID absence, etc., impacting on service capacity. And that means that the enablement service hasn't had the same output for those individuals who do require ongoing care, and it's reduced the overall capacity within the enablement teams. So this is something we're really heavily working on just now. We're taking papers tomorrow to the IGB in North to look at expansion of home support enablement capacity, and also expansion of our integrated rehab teams and the development of home first teams as well. And we'll bring a paper through the next cycle of committee just showing the work that's been taken through the IGB. But you'll be able to get those the reports on that paper on Mars as well. It's going to the special IGB committee tomorrow afternoon. So a lot of work ongoing just now in the background to try our best to resolve that capacity challenge so that we can get enablement running back at its full capacity. And again, in terms of 2.7, in terms of integrated equipment and adaptation service, this has really been driven by significant increased demand. We've had huge demand from hospital around discharge support for with equipment, and the service is currently running at 70% of those deliveries being achieved within 7 working days against a target of 80%. So the service has actually done remarkably well, in my opinion, given the fact that we've had obviously COVID absences impacting on capacity, as well as a huge increase in demand. But this is another area that's picked up within the business case that's going to the IGB tomorrow to expand on a recurring basis the capacity of the equipment service so we can better meet the needs of our local population. So those are the main areas of concern noted within the performance framework at the moment, but I'm happy to take any questions on any aspects.
Thanks very much, Ross. And first in is Colin.
Thank you, Tom. My point falls slightly outside the framework. It's to do with the enablement service. It might be of use in to the next meeting of the committee, whether it's ourselves or not, to also have the numbers of people that are coming out of hospital using the hospital's, I can't remember what you call it, it's out of hospital care service, that allows them to get back without actually having to access the council's reablement service. So it might be worth seeing the numbers. I know that falls under the IJB. It might be worth having that data as well, just as maybe as a one-off or as an extra, so that the councillors are able to see the numbers of people that are actually coming out of the hospital compared to and being able to be helped before they touch the council services, as well as the numbers of folk that are actually having to access the council services themselves.
Yeah, thanks, Councillor. What we can do, so the Home First teams, and I'm calling them Home First. We may choose a different name for them, but these will be run by the Health and Social Care Partnership. But the aim behind the sort of Home First modelling is that where we get individuals in the hospital environment that require a complex assessment on the site, what we would do is support them home with wraparound care into the community and allow them to have that assessment in their own home. And the aim behind that is, A, we reduce the amount of time people deteriorate by remaining in a hospital bed, and B, it gives us a much better opportunity to get that assessment right. And these are sort of life-affirming and life-defining decisions we're taking that, you know, may require people to go into institutional care rather than remain in the community. And we know we give people a much greater opportunity to remain in their own community if we do that assessment within their own home. Equally, that same setup works from the community setting as well. So if we've got somebody who is teetering on the brink of requiring a hospital admission, we've got the same wraparound support that we can put in place from the community end to try best to reduce the likelihood of them being admitted into a hospital bed as well. And we're also expanding the capacity around things like hospital at home services as well, and also some of our community nursing teams, so we can provide better wraparound supports in the community as well. So it kind of comes together. Behind that, we have got a lot of work ongoing nationally around data sets that are going to be used for these type of models. And Graham from our performance and planning section has been up the middle of that as part of those national discussions. So we will be building those into our future performance frameworks, and very happy for those to flow through from the IGB as well as the Adult Health and Social Care Committee, so you can start to see some of that throughput and demand, and seeing it both from the hospital angle in terms of discharge out, but also crucially, I think for me, is the admission prevention bit as well.
You okay with that, Colin?
Thank you very much.
And Claire.
Thanks, Chair. Thanks again for this, Rose. I just got a couple of questions. Is there any issues? I know there were ongoing issues previously about actually being able to procure equipment, partly to do with the pandemic and maybe a lot to do with Brexit. Is there any issues about the equipment being able to be delivered? Is that part of maybe a problem of people not being able to get home because the equipment isn't available? My other question is at 7.1, where it's saying that the statistics are incomplete. Obviously, will that kind of catch up for the next report, being able to show us, was there an issue? Has that figure jumped or either in one direction or the other because there was an issue with Swiss, and just on not just on a personal basis, but also on behalf of my group, just to say thank you so much for yourselves for the amount of work that has been done over this. Not just the pandemic has brought things into sharp focus, but also previous. Because the work that's done in these reports that comes to us at Adult Health and Social Care, anything that we have asked to go back and for you to adapt the reports to give us more information on certain areas, you have done it willingly. And especially with the amount of work that you have got to do in the background, especially over the last 2 years, which is ongoing, really to get on record my appreciation for that's been done. So really, thank you, Diane, thank you, Ross, thank you, Nikki, and thank to everybody that's working within Adult Health and Social Care. It's been a horrendous 2 years for everybody. It's still ongoing, it's not over yet. And I say just to give you both my personal and my group's appreciation for the work that you've done.
Thanks very much, Claire. I think we can all endorse that. It's been a pleasure being in this committee. There's no one else in the chat, Claire, so you are the last word for the
Do you want me to jump in? So sorry about
I still had a couple of questions.
no, you didn't.
I just jump in and thanks for that. We'll definitely pass that on to the whole team. It's a big team effort, and obviously pulling a lot of this together. In terms of the availability of equipment, it is an ongoing challenge, and we've had this over the last number of months in terms of the availability of equipment. Has proven quite difficult, and we've had a number of items of equipment on back order. And what we try our best to do is have a look at all alternatives that are available as part of that process. So we try best to look at alternatives and do as much sort of preparation and pre-ordering as we can to hold stock of equipment to try our best to get ourselves through. But it's certainly been a feature of the last 12 months, particularly where we've had quite significant challenges around equipment availability, which we've not really faced before. We're doing everything we can in terms of pre-planning around that to try best to reduce the impact.
You okay with that, Claire?
Thanks. And just the start at 7.1, will that be followed through?
It will absolutely be, and again, we're obviously currently doing some work around the procurement of the new system that will replace Swiss as well. And I think the important part here is that we're taking the learning from some of the current challenges in terms of performance reporting that we've got, and making sure that the new system will be much more fit for purpose to be able to actually pull out a whole range of useful performance data, not just for committees, etc., but actually for the day-to-day running of the service that will make a huge impact for us. So it's right at the top of our agenda at the moment as we go through that process.
Okay, thanks very much, Ross. Thanks, Tom.
Right, Claire, that's lovely. Well, that wraps us up, as they say. As Claire said, it's been a pleasure.
Councillor Gould has been trying to get in from the start of this meeting, some connectivity problems. I think we should record an apology from her.
All right. Thanks, Kevin, for that. Yeah.
Thank you.
Kevin, I've managed to get in the middle of it, so thanks again. I managed in the middle.
Just as well we didn't say anything bad about you then, eh?
Oh, well, I'm sure somebody just stuck up for me.
Don't see any hands going up, Mary. Anyway, on that happy note, thanks very much to everybody, and again to the Ross and his team. Thanks very much. Maybe see you next time. Maybe not.
Yeah. Thanks to you, Chair.
Thanks.